Let's continue with obstructive disease of lung. Now the first topic here, COPD, chronic obstructive pulmonary disease. In chronic obstructive pulmonary disease, we have two parts here. One thing in COPD, two things here. One thing is emphysema, another thing is a bronchitis. One is emphysema and one is bronchitis. Emphysema is one and second here bronchitis. So what's the main cause for this disease? This disease is related with the cigarette smoking, the heavy exposure to the tobacco. So this disease is common in smoker. The smoke chemical leads to inflammation at the level of alveoli, emphysema, damage to alveoli, and it can lead to inflammation of bronchi. When inflammation of bronchi, the exact definition of the bronchitis is, according to WHO definition, is a persistent productive cough. It's a persistent productive cough. The 3 consecutive months from the 2 consecutive, like from the 2 years, the person are having the 3 consecutive months having cough. That cough is a productive cough, the mucus production from the bronchi. That's a productive cough from for 3 months, and in the 2 consecutive years, in 3 consecutive months, the 2 consecutive years are having the productive cough. That's the clinical scenario for the bronchitis. So these two disorders related with smoking. Okay, let's talk in detail what's the etiological type. For first thing was the emphysema. First we discuss about emphysema. But the different types of, according to etiology, the different types here, the one congenital emphysema and the acquired emphysema. The acquired emphysema is acquired cases due to smoking, and this case in adult. The congenital emphysema present in the childhood, in the child, the age 5 year, 10 year age, having congenital emphysema. What's the congenital emphysema? It's a destruction, you can see here, classified as tobacco is the cause here. What's the genetic cause related with congenital emphysema? We're having alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency. This is this alpha-1 antitrypsin is the antiprotease enzyme help for breakdown of this the axonal matrix, the elastases enzyme present in the axonal matrix, and we're having the other category of proteases enzyme like collagen breakdown enzyme. These enzyme known as metalloprotease enzyme. So this metalloprotease enzyme, they try to break the extracellular matrix, collagen elastin, the alveoli wall, the composition, collagen elastin support the epithelium cell, the alveoli. Alveoli, the composition here, we're having extracellular matrix, the period between the alveoli. The septa, alveolar septa is also formed by extracellular matrix. So if you have deficiency of this alpha-1 antitrypsin, what is alpha-1 antitrypsin? This enzyme is antiprotease. This enzyme works against the protease enzyme. So if genetically we have deficiency here, during the process of remodeling of extracellular matrix, there must be balance between breakdown and production. So if you break too much and production little, so what happens? Axonal matrix quantity going down. It lead to congenital emphysema. The child having a genetic issue here is lead to congenital emphysema and no smoking, without smoke. Okay, the second etiological type, the acquired category, the smoke chemical lead to the cytokine protease or smoke chemical. For example, here we're having the nicotine is the chemical present in the smoke. This nicotine doing what? This nicotine activates the neutrophils and neutrophil producing enzyme, elastase enzyme. This elastase enzyme doing what? They break this axonal matrix, and what happened? That's the alveoli parenchymal destruction start. it lead to emphysema. So that's emphysema. There are two different types of emphysema. It may be congenital, it may be acquired. The acquired type of emphysema, this emphysema is a part of COPD. This emphysema is a part of COPD. And now we talk about according to etiology, we classify emphysema to congenital emphysema and next acquired emphysema. Now we talk about the anatomical type of emphysema. The emphysema, to understand the anatomical type, we must focus on this SNI. What's the SNI word? In the SNI, in one SNI, what's the norm as SNI? We're having here respiratory, bronchial. Second, we're having alveolar. The third thing, we're alveoli. These three parts together known as one SNS. This unit, this SNS is also a respiratory zone. It's a respiratory zone. It's a respiratory zone of respiratory tract. The respiratory tract having two zones. One zone is conductive zone. One zone is conductive zone just help for like the air is moving to alveoli with the air movement, just no gas exchange, the air just move. That's the conductive zone. And second zone is respiratory zone. The respiratory zone here we can do, it's a SNS. Respiratory zone is a SNS. We can do the gas exchange here, the mainly O2 and the CO2 gas going out, O2 come inside. So gaseous exchange zone. Now, the emphysema level of respiratory bronchial. What happened to respiratory bronchial? Now, this part is respiratory bronchial. If the full length of this respiratory bronchial, this emphysema may occur in the central part or it's a central SNR. If in the distal part, it's a distal SNR, central SNR. If the emphysema involve the full length, from proximal part of SNS to distal part is a pan SNR. Pan mean complete. Central is the central part of SNR. Distal is the last part of SNS. And irregular SNR mean it may be here, it may be here. It depends upon like what's the meaning of the distal SNR, the irregular SNR. Irregular SNR may sometime here, may sometime here, may sometime here. Is not pretty sure about what's the exact location. Okay. The most common type of emphysema here, the most common type of emphysema is the central SNR emphysema. The central SNR, what's the etiology here? The central SNR emphysema is the most common type of emphysema. Central SNR is the central part of the SNS involved. This is what's the common cause is smoking. The smoking lead to central SNR emphysema. Must keep in mind, it's very important MCQ for the exam purpose. And if the child having congenital emphysema due to alpha-1 antitrypsin deficiency, it lead to pan-SNR emphysema. Complete SNR is affected. Complete. It's a pan-SNR. It's a pan-SNR. It's a pan-SNR. Complete length. You can see here full involvement here. If the just here is a central SNR. It's a central SNR. And the last part is a distal SNR. Last part involved is the distal SNR. So the three main types here are irregular, very rarely happen, or these are the classification according to which area is anatomical type. The anatomy of the SNS. So which area of the SNS is involved. The first part, the irregular part, the full SNS is involved. The classification of SNR is emphysema classification according to the location in the SNS. What's up? Emphysema. Emphysema have a relation to bulla. You can see here the bleb formation is air filled. The bulla is actually this word is come from blister. It's a blister, present on the skin. If the skin having here swelling here and contain water inside this, it's a blister. But this blister is similar to that blister, quite different thing. It present in lung. This blister having water inside. The blister present over skin having water inside. But the blister present here, this blister consists is air containing blister. We having air here in this blister. is known as bulla. So what's the relation of the emphysema with the bulla? Now what's happened? The last we done with the respiratory bronchiole, the vision, alveolar duct, this anatomy. Just in last previous slide we talk about this SNS. When we discuss about the types of emphysema, if the emphysema involves the distal part, the most distal part, this part emphysema, if a destruction of the alveoli, what happened? Around this we having here the parietal, here the visceral pleura here, and around it we having here parietal cavities. It's a pleural cavity here, it's the parietal pleura, it's the visceral pleura. Okay, when the emphysema, if the emphysema is here in this part emphysema, then what happen if the emphysema in this part? It can lead to, if emphysema in this part, now it can rupture, and rupture now air can enter to pleural cavity here. And the first formation here, the air is collected under this visceral pleura, or is the blister form here. The blister form, this blister is the bulla formation. So this emphysema, the alveoli is connected to the visceral pleura. Alveoli connected to visceral pleura. The air is under the visceral pleura. When this visceral pleura rupture, if the visceral pleura rupture, now air can go to is the pleural space. It can lead to, when bulla, the emphysema lead to bulla, and the bulla lead to development of pneumothorax. If the patient having lot of bulla there, this pneumothorax not just one time happen. This pneumothorax can be again and again and again and again. It's a recurrent pneumothorax. What's the cause for recurrent pneumothorax? I must think about COPD. If the patient having the again and again the attack of pneumothorax, repeated pneumothorax is maybe COPD. The which COPD part, the emphysema lead to bulla, the bulla lead to repeated attack of the pneumothorax. It's a recurrent pneumothorax due to development due to COPD. The which part? The emphysema. Okay, which emphysema? The question here we having the four types here. The emphysema, distal acinar emphysema, centri-acinar emphysema, pan-acinar emphysema, and irregular acinar emphysema. If the examiner asks question here, which emphysema easily can lead to bulla formation or the complication pneumothorax, is the distal acinar. Must give answer here. The distal acinar emphysema, more chances to develop the bulla formation, more chances to develop bulla. When bulla formation, their bulla easily lead to pneumothorax. It's all about the relation of the emphysema with the bulla. Here you can see, already explained the last slide. It's alveolar duct here. It's the alveolar duct, respiratory bronchiole. You can see here this membrane. This membrane is the parietal membrane. It's a visceral membrane. Now the air from the alveoli going to enter to this pleural space. It can easily lead to pneumothorax. So the bulla rupture. When bulla rupture, it lead to pneumothorax. And this pneumothorax can be occur again and again. This pneumothorax is recurrent pneumothorax. The recurrent pneumothorax. As the chronic bronchitis. The chronic bronchitis is described the person having cough from 2 years for 3 consecutive months. From 3 months, the person doing productive cough. Person having productive cough. And this person, the productive cough, and when this person, the COPD patient, is also the second part of COPD. The COPD patient, the one part is bronchitis, and the sputum is a bit clear sputum, and the mucopurulent is a bit rarely. The purulent sputum belongs to bronchiectasis. The mucinous secretions there, this secretion there, continuous secretion there. It's about the bronchitis. Okay, next we continue in the next lecture about the bronchitis. We continue in the next video.